Hello, my name is Haley Floss, and today I'll be talking about gum disease and the long-term effects of bone and tooth loss. So on the second slide of the PowerPoint, you'll see what's called a panoramic X-ray. It shows all 32 teeth along with the surrounding bone structures, including the mandible and maxillary bone. So you can kind of observe the bone levels as that slightly transparent line going across the teeth, separating the root portion from the coronal portion. So keep this in mind because later on you're going to be seeing another x-ray as well for after all the teeth are removed and the bone has healed and receded, or also known as being resorbed. So as we all know, we have bacteria all in and outside of our bodies. We have the transient flora on our skin, we have bacteria in our digestive system, in our mouths, some that are helpful that aid in digestion. As we all know, digestion starts in the mouth. But some are also harmful, which are the kind that cause cavities and gum disease. So this bacteria lives in what is called plaque, which is kind of like this sticky film that's on our teeth. It never fully goes away. You brush every day, but it builds back up, which is why you're supposed to brush, 2 or 3 times a day. So this bacteria specifically likes to eat sugars and starches, and from what they eat, they excrete acid onto our teeth, which is not good. That's what helps break down our tooth structure and causes what we call caries, also known as cavities. So when this bacteria is allowed to do that along our gum line, it causes our gums to kind of, if this were the tooth and this is our gums, the gums will recede back due to the irritation and form what we call periodontal pockets, which just from how that sounds, it's not a good thing. And if this is not addressed early on, by flossing, going to the dentist, getting a cleaning, having the bacteria under there scooped out and allowing the gums to close back around the tooth, just more bacteria gets in there. They continue to excrete acids, which continue to irritate the gums, which make the gum continue to move away from the teeth and deepen the pockets until it's around the bone there, which then the bacteria will continue to excrete acid onto the bone, which starts to break down the bone instead. So on the fourth slide of the PowerPoint, you can see in the top right corner what we call a periapical x-ray, showing kind of like a close-up x-ray actually, where you can see that yellow line is where just normal healthy bone level should be, and the one underneath it shows bone after it's been affected by periodontal disease. The picture also shows that sort of progression of normal healthy gums to just gingivitis, which is just the irritation of the gums, to the forming of the periodontal pockets, and eventually the breaking down of bone. So what causes periodontal disease? It has a lot of causes. So one of which would be smoking and tobacco use, which both of them damage your immune system and impairs healing. So you can't really fight this bacteria. Essentially, periodontal disease is an infection of your gums. Just like an ear infection, a toe infection, it's like the same thing. If you don't have a healthy immune system, you're going to have trouble fighting it. So other diseases can actually help cause periodontal disease, such as diabetes, cardiovascular disease, HIV, and AIDS, all of which also affect your immune system and your body's ability to fight the infection. Some other causes would be a handful of different medications, such as some antidepressants. There are some cold medications that decrease saliva production, which saliva helps kind of kill this bacteria. It has other enzymes and properties that fight the harmful bacteria. There are some anti-seizure medications and calcium channel blockers that also affect the immune system. Poor diet can also affect it. So an intake of sugar, like soda and candy, you're basically feeding the bacteria. Also, a deficiency of vitamins and minerals that are needed to strengthen your body, your bone, and your immune system, like vitamin C, can also have an effect on it. Hormonal changes like pregnancy or puberty, again, affect your immune system. Stress lowers your immune system. And some people, very unfortunately, are just inherently predisposed to having periodontal disease. So about a third of the population has period disease, despite living a healthy lifestyle, having good oral hygiene. They take their vitamins, they eat well, they sleep well, and they have it. It runs in their families. Which it also shows on the slide there. Research has shown that any oral infection, whether it's the tooth infection at like the apex of the tooth, or you have a lot of like a breakdown of a tooth, it's in the nerve, anything like that, or just gum disease, it can cause or is connected to all these other diseases, such as diabetes, cardiovascular disease, strokes, and more seriously, I mean, they're all serious, but preterm and low birth weight babies. So period disease doesn't cause diabetes and heart disease, but they're kind of all connected here. So some of the effects of period disease would, as you see in the picture, include gum recession and root exposure, which can make your teeth quite sensitive because the roots of your teeth don't have that same outer coating that the coronal portion of your teeth have. And so any sort of hot, cold will irritate your teeth, potentially causing pain. Tooth mobility, which is where your teeth become loose, or just tooth loss, where they fall out because they no longer have the sort of support that they need to keep them in place anymore. And sometimes, based on the pain that you have, it's just necessary to have them removed. So, moving on, just needing the teeth out or just having the tooth removed doesn't entirely solve your problem. You may have the teeth out, you may have the period disease cleaned up, but really, bone doesn't come back. It's not like when you get a scratch and it heals and you're fine and it's good, your bone doesn't grow back. Same thing as your teeth won't grow back after they're gone, which is why it is so incredibly important to go to the dentist every 6 months, have it checked, have your teeth checked, get your cleanings, because this is your only set of teeth. You know, it's like losing your head. You only have one in your life.